governments to support their efforts to address responses to infectious diseases. And in the case of Nigeria, where we did have Ebola cases, the Nigerians were able to control this because they had an effective CDC-like operation that they had worked over many years to develop. And we're working with Ghana as well on developing that capacity. Still, there's tremendous additional effort that will be required in terms of building Africa's health infrastructure. What Ebola showed us is that infrastructure is extraordinarily fragile, and any infectious disease that occurs on the continent can really force a total collapse. And we saw that collapse take place in the 3 Ebola countries. So we are more than engaged on trying to address these issues across the continent, because you can't do it just in one country. You have to work in all the countries to ensure that any type of infectious disease doesn't cross borders, because they don't recognize borders. And we certainly saw that in the case of Ebola. But we've had Ebola-like diseases in Central Africa for many years, and it's been kept under wraps. So there is some progress being made, but I agree with you, a lot more needs to be done. But we can't get tired, because if we get tired, we will be defeated. And I'm not prepared, and I don't think our Center for Disease Control that is intensely engaged in this, that any of us are prepared to declare defeat at this point.